Hello, and thank you for joining us on this edition of Let's Talk DeKalb. I'm Diamond Lewis.
And I'm Aviva Hoffman.
Well, Aviva, we certainly have a lot of ground to cover, and it's all in the name of health. In fact, picture this. Picture a healthy DeKalb. That's what we're going to be talking about on today's show. We'll explore many of the options on how you can get and how you can stay healthy. We'll talk about the obesity epidemic, many of the problems and many of the solutions surrounding that epidemic, and we'll talk about a $1 million grant awarded to DeKalb County to make sure the future of our county is a healthy one.
And we're taking our healthy ways on the road. We'll have an international travel expert on our show to talk about what you need to know before you go. And before you take another bite at a restaurant, do you know how to find out if that restaurant is going to leave a bad taste in your mouth or have you coming back for more? We'll have everything on restaurant inspections coming up. Also, a little bit later in today's show, we're spotlighting a company headquartered right here in DeKalb County that's helping save lives across the globe.
But first, you may have heard about the HBO hit documentary series, Weight of the Nation. Well, guess what? HBO's producers actually brought one part of that four-part series right here to DeKalb County's own Porter Sanford III Performing Arts and Community Center. DCTV takes you to that special screening right now.
This is all I've known. I've only known being obese. A lot of the people that I've been around growing up have mostly been obese. And so for the series, it was unique for me because they touched on so many different facets, from the childhood struggle over into the economic and agricultural struggle.
Plump, big-boned, thick. These are just some of the words often used to sugarcoat the issue of obesity. But consider this, the state of Georgia is ranked number 2 in the nation for childhood obesity. Still thinking about sugarcoating the issues? DeKalb County government and local health officials could not take this information lying down. That's why officials partnered with HBO to screen a segment of its 4-part series, The Weight of the Nation, shedding light on the true impact of obesity and many factors contributing to this national epidemic.
But we wanted to make the dialogue more intimate. How does this impact DeKalb County specifically, and what can we do to address it? Because we can have information, but we're really going to try to let people know this is what we as the Board of Health and some of our other partners are trying to do to take care of this.
And I think it's important for us to see exactly where we are, to see what the world sees, because a lot of times we don't really look in the mirror and we're not honest with ourselves. So if obesity is a problem, it's something that we have to see in order to face.
In an effort to get our communities talking about the elephant in the room, this screening held at the Porter Sanford III Performing Arts and Community Center set the stage not just for a chance to enjoy HBO's critically acclaimed documentary, but also encourage citizens to take control of their own health and the health of those most important to them.
We have an obesity epidemic in America, and that includes DeKalb County. And so we have to raise awareness so that the people, the citizens who live in this county and across the nation know how to live healthier, longer, and more productive lives. And it's got to start with our children and what we expose them to, the neighborhoods and the environments that they live in, and the number of things that have brought about this epidemic. And so this is about awareness raising so that we can then answer the call to action and actually do something about it.
Obesity isn't just about trying to lose weight. In fact, that's just the tip of the iceberg. Studies show not just how you live, but also where you live can play a major role in your overall health.
Most people think it's about running and exercise. It's about a state of mind. It's about being where you are and being fit, exercising. If you're walking, you just take some more extra steps. You don't have to do all these extra things a lot of people try to prescribe. It's all about just connecting and making a difference.
Through the Master Active Living Plan, county officials are working to make certain DeKalb families won't have to travel far to access natural paths for exercise or grocery stores where they can find fresh fruits and vegetables. And that, says Vivia Armstrong, has made her very public battle against obesity worth every tear.
I just had to trust, for me, I had to trust God that it was going to help somebody. My pain and my struggle with weight that has been consistent because I've never known anything thin, anything below a size 12, 14. Wish I was a size 12, 14. And so I'm hoping that that'll help a little girl like a little Vivia.
And a special thank you again to those HBO producers for bringing that screening right here to DeKalb County.
And we're just getting started on this healthy Let's Talk DeKalb, so stick around, much more right after this.
Welcome back to Let's Talk DeKalb. Now, it's not a big secret, but it is a big problem, obesity. And that's why DeKalb County's Board of Health is working to invest millions of dollars to combat obesity right here in DeKalb County. Joining us today in DCTV studios to talk to us about this also important initiative is Dr. Sandra Ford with the Board of Health. Thank you so much for joining us today.
Glad to be here.
Now, Dr. Ford, in our earlier segment, we showed how you and your team worked to bring HBO's Weight of the Nation documentary series right here to the Porter Sanford III Performing Arts and Community Center. But you've been working for quite some time to take the state of health in DeKalb County on a national stage. Tell me about what brings you here to this position in serving as DeKalb County's top doc.
Well, I'm a pediatrician by training, and obesity is a big issue, obviously, in the pediatric community. I was working in Washington, D.C., and decided I wanted to stretch out a little bit, and so I got a job offer to work in public health in Florida, and that's when I started and decided that I really liked impacting health on a much larger scale than your small office of patients, and so that's how I landed here in DeKalb. Been here for 8 years now.
You've worked to tackle so many health issues here in DeKalb County, and your newest challenge is obesity. So first, tell us about the definition of obesity and the condition of being obese and being overweight.
I'm glad you asked that because there is a big difference between obesity and overweight. Overweight is if you are heavier than your expected weight based on your body mass index, your BMI. You hear a lot about BMI. BMI is basically your height for your weight, and you should have a BMI less than 25 to be considered of normal weight. So if you are over 25 for your BMI, you're overweight. Now, if you're obese, that means that you're significantly heavier.
How is obesity now impacting the lives of our children?
Well, in this current generation, in the last 30 years, the percentage of obese children has tripled.
Wow.
In the United States. And so what we're seeing are fourth and fifth graders weighing more than 100 pounds, having BMIs in the 30s, and it's really significant. I would say right now in DeKalb County, about 1 in 5 of our children are obese.
And then what about adults?
In DeKalb County, about 1 in 3, about a third of our DeKalb County citizens are either overweight or obese, which basically means they weigh more than they should.
What's the economic impact of obesity here in DeKalb?
Just in Georgia alone, it's huge. Georgia spends $2.6 billion a year, billion, on obesity-related issues. Imagine what we could do with that money if we didn't have that problem.
What other health risks are associated with being obese?
The main issue is that you're going to have chronic diseases. You're going to have diabetes, hypertension. You're at risk for things that you shouldn't be at risk for. Stroke, heart attacks, joint issues. Just being heavy puts more strain on your joints. And so these are folks that are achy all the time. They hurt, they don't feel well. And especially for our young children, to be having those issues so young means that by the time they reach adulthood, they're really going to have a difficult time operating in society.
What is the actual cause of this epidemic that's now sweeping the nation?
It's very simple. I mean, basically, we eat too much and we don't exercise enough. But
I'm guilty.
Well, we all are. But the real issue is that if you look at the history of portion sizes, not just in the fast food industry, but even in regular restaurants, the plates are larger, so the amount of food on the plates is greater, and so we eat more.
So tell me about this initiative. What is the Board of Health doing here in DeKalb County to combat obesity?
Well, we're doing a number of things, and we're very excited to have received some federal funds to address this issue. We have $2.6 million right now that's been focused on specifically obesity, physical activity, promoting good nutrition. We're working with all of our great partners. We talked about childhood obesity. We have a number of partnerships with the school system here in DeKalb County. We're going to be doing farm to school so that children learn how to grow healthy food. I'm a California girl, so I'm used to reaching out a window and grabbing an orange. So just so they understand how much healthier, how much more flavorful food is that comes straight out of the garden. So we'll have gardens in some of the schools here in DeKalb County. We also have a Safe Routes to School initiative to encourage children to walk to school. And sometimes even let's encourage their parents to walk with them to school so that they're also moving.
How can our viewers become involved with all that you're doing, what the Board of Health is doing to combat obesity here in DeKalb County? And where would they go to find out about all these wonderful programs you've just discussed here today?
Well, the main thing right now, I think, is this Master Active Living Plan, because we want input from the community. Where are the areas that you think these interventions are most critical. You're going to have to give us feedback on what do you think about this neighborhood versus that neighborhood. Do we want sidewalks here? Do we want bike paths here? Walking trails? So there'll be a lot of opportunity for public comment on the Master Active Living Plan. Use those facilities. Go to your schools and run on the track. Make it worth our while to do these things. It's terrible for us to have the opportunity to do it and then nobody comes out and uses them. Make sure your kids understand about gardening. Try to grow a garden yourself. Encourage them. We're the best, as a parent, I say, we're the best role models for our children. So get out there with your kids after school and walk a little bit. It's a great opportunity to just talk to them and see how things are going, but also just to promote physical activity. So there's a lot of things that we can do, but basically just move, keep it moving is the easiest thing.
Dr. Sandra Ford, thank you so much for joining us today, and thanks to you and your team for all that you're doing to keep us healthy here in DeKalb County.
My pleasure. Thank you for having me.
Now, for more information on that Master Active Living Plan, stick around. We're going to have more information on that program later on this edition of Let's Talk DeKalb. Also, did you know that you need to make sure you have certain vaccinations before you vacation overseas? Make sure you stick around because we'll have all that information and much more on this edition of Let's Talk DeKalb. Stay tuned.
Welcome back to this special health edition of Let's Talk DeKalb. Now, the DeKalb County Board of Health also has helpful information for people that are facing travel-related decisions that deal with vaccinations, medicines, and other issues to have safe travels internationally. And on our show to talk about this is the medical director of the Board of Health's Travel Clinic, Dr. Alawode Oladele, and he is a Morehouse graduate, Morehouse Medical College graduate, and a well-known expert on infectious disease control and prevention. And we're very glad to have you on our show today. Welcome.
Thank you, Aviva. It's a pleasure being here.
All right. Now, in this area with Hartsfield International Airport right around the corner and in DeKalb County, such a multi-ethnic, population of residents and businesses operating, global travel is a daily occurrence here. So what is the most pressing health problem we've got when we think about international travel?
Well, obviously, you do not want a medical condition to prevent you from enjoying your travels. And there are a lot of potential health issues that you can encounter. The number one health issue, approximately 20 to perhaps even 50% of individuals will develop traveler's diarrhea.
Oh dear, that's not any fun on a travel.
No, not at all.
Well, not at any time, but especially when you're not at home.
Exactly. And most traveler's diarrhea is caused by bacteria, but it can be caused by parasites, can be caused by viruses. And in fact, most diarrhea caused during travel is self-limiting, but even with that, you definitely do not want to get diarrhea while you're traveling.
And we take things for granted here in our home of DeKalb County in America, where things are, on average, a lot cleaner, a lot safer. So we have to be careful, and there are some precautions when we're in a foreign country, right?
Yes. And what I always say is boil it, peel it, cook it, or don't eat it.
Okay, that is good advice and easy to remember.
Yes, and what does that mean? It actually means that you don't want to drink unsafe water.
Right.
You don't want to eat food that is not completely cooked. So undercooked food is not good. And don't forget, even ice in your drinks could have come from contaminated water.
That's
and
right.
even basic issues such as brushing your teeth with unsafe water can put you at risk.
That's right. Well, how does the process start as far as it relates to travel clinics? How does someone, get involved and learn more and protect themselves?
So if an individual comes in to see us, the first thing we want to do is to make sure that you are medically stable enough to travel. What does that entail? Well, if you have multiple medical issues, we want to talk with your personal doctor. And in fact, we work very closely with your personal doctor to make sure that you're medically safe enough to travel. There are several other steps. After you come in, we assess your stability. We then want to figure out where you're going and what the risks are in the country that you're heading.
Every place is different.
Every place is different.
Right. Okay. And then what other services do you provide?
We do a very comprehensive needs assessment. We will take a look at your travel agenda, and we will decide what your risk factors are. We will decide what immunizations you require. We then decide what preventive medications are required. And we offer all of this at the DeKalb Health Clinic.
That is wonderful. Now, suppose somebody comes to you and they do have a chronic illness, or you've talked with their doctor and there are some health concerns. Certainly that doesn't mean all travel is off. What would you do? How would you advise them?
The first thing I would suggest is to get a letter from your doctor stating what your medical condition is, and to get a letter delineating what medications you're on. After that, you need to make sure you have enough medications, if you're on medications, to take with you on the trip. The medications need to be in the original bottles, clearly labeled, and you need to take an extra prescription with you with the generic names of the medications written on the script.
That is good advice, right? Now, what happens, though, if you're traveling and you get sick?
If you're traveling and you get sick, first of all, if you're going to travel, you need to understand that for the most part, the majority of the health insurance plans do not cover you while you are traveling.
That's a good point, right?
And so you should get some sort of short-term policy that would cover special issues such as Medivac. So if you do get sick, you can be taken out of the country, and special hospital coverage. So those are some of the things that you can do. And of course, when you do get to the country where you're going to, you should report to the consular office or the embassy.
Okay, very good advice. Now, they say doctors make the worst patients. I have to ask you, have you had to kind of listen to some of your own advice on your travels?
Absolutely. I actually just got back from Haiti. And yes, just like I encourage everyone to take their preventive medications, malaria is something that is at risk. You're at risk for malaria in a lot of the countries, and the kind of malaria is different. And so we encourage people to take malaria preventive pills because we do not have an immunization or a vaccine for malaria.
Okay. And so I imagine you have a lot of resources available at your clinics if somebody's not sure what kind of vaccinations or preventative medicine they would need. You'll be able to help them, right?
Absolutely. What we do is we offer low-cost medications for malaria. We also have all the immunizations that you need. The most popular ones are typhoid vaccination and then yellow fever. Yellow fever is one of those vaccinations where some countries is an absolute requirement. If you don't have it, you actually cannot get into the country.
Okay, wow.
So we have all of the immunizations, and we write prescriptions for the preventive medications.
All right, one-stop shop.
Yes.
So how many clinics are there? How would people find out about them or come to your clinic?
There are 2 clinics. There's one in Central DeKalb, is the Theo Vincent Health Center on Windway. And there's another clinic in the north end of DeKalb. And the easiest way is to go to our website, www.dekabhealth.net. And you can actually make an appointment to come in. And you should make an appointment at least a month or so before you decide you're going to travel.
All right, that's a very good point. Thank you very much. And one final question, how does it feel to help empower people to have safer travels?
Oh, it's wonderful. There's nothing worse than traveling and then getting sick while you're out there, or coming back and then getting sick. And it's an extremely important health issue because let's take malaria, for example. Malaria can kill. Okay, and so we have had people who have not taken their preventive medications, who have traveled and felt that they didn't need the medications, and then they return and they develop malaria.
Oh, no.
So it can be a potentially
serious
situation.
Thank you, Dr. Oladelli, for being on our show and imparting some very important information about traveling internationally.
It's been a pleasure, Aviva. Thank you.
You're welcome. Now stay with us because we did talk briefly earlier in the show about the Master Active Living Plan, but we're going to go in depth and explain how it's improving the health here in DeKalb County. That and more right after this.
Welcome back to this special edition of Let's Talk DeKalb, where we're focusing on the health of DeKalb County. Joining us now is Sydney Dowse, who's a senior planner with the Department of Planning in DeKalb County. Thank you so much for joining us today.
Thank you for having me.
Now, first, explain to us what exactly is the role of the Department of Planning and Sustainability in DeKalb County?
The easiest way to describe our role is zoning. Most people watch the Board of Commissioners meetings. All of these zonings that you see taking place have to be reviewed, and the recommendations come from our department. In addition, we do long-range planning, such as what I'll talk about today, and we also deal with code enforcement and the One DeKalb.
So certainly our viewers want to know, why would we have a senior planner for DeKalb County on our show all about health? Tell me, what is the role that your department is playing in terms of this Master Active Living Plan, and how is that going to help the health of DeKalb County?
The public health field has started to pay more attention to what they call the built environment, and what to us is where we live and where we work, where we play. Obesity is a major issue, and they're noticing that the more people have increased physical activity, not just going to exercise, but in their day-to-day activities, obesity is reduced. So the CDC and the Department of Health and Human Services is starting to focus more on the built environment and mixed-use development in ways to allow it to make it easier for people to not depend on their car and to walk or bike to take care of their daily activities.
And part of that focus is actually funding these types of activities. So
Yes.
if you can tell me about a more than $1 million grant that DeKalb County won for this effort?
The DeKalb County Department of Health applied for a grant from the CDC and Health and Human Services called Communities Putting Prevention to Work, CPPW. We have a lot of acronyms. The purpose of the grant was to focus on obesity and on tobacco. Under the obesity portion of that grant is the Master Active Living Plan, and they will work with our department to look at ways to make walking, biking, and access to the county's parks, schools, and facilities easier over the long term. It's a long-term plan with a long-term focus.
What type of planning goes into this long-term planning for DeKalb County? Talk to us about what is the process for the Master Active Living Plan.
The process will be, we're going to focus on about 8 areas within the county. The department has what's called a comprehensive plan that has a future land use map, and that is not the day-to-day zoning, but the long-term blueprint for the county's growth. Within those areas, we have areas that we call activity centers. What they are primarily our major intersections where our shopping centers and our apartments exist. The county's built out. We don't see that much new development. So over the next 50 years to 20 years, we see redevelopment of some of the existing commercial and multifamily areas over time. Those are the areas where we want to promote more mixed-use development and areas where people will have the option to have denser housing and to walk more. We will hire consultants to look at 8 of these areas, and they will look at redevelopment plans within these areas, and this is an example on the map behind us. How do we allow them to be built in a way where housing can be on the same site? At the same time, how do we increase the access to the surrounding neighborhoods so you can walk right to the shopping center instead of driving? And in addition, how do we better connect it to the areas surrounding schools and parks? As shown in the map behind us, you have a middle school, a park, recreation center, and another park all within a quarter mile. If you had the appropriate bike lanes and sidewalks, the neighborhoods, kids in the neighborhoods could walk to these places, and if housing was built where some of our primarily commercial areas are, people could take care of their daily activities and get to some of the county's facilities and assets at the same time.
Right. So if I'm able to walk to the grocery store or to the shopping mall from my home, certainly that's going to be better for my physical health, but it also will impact our environment. So talk about how this Master Active Living Plan will also benefit our environment as well.
Right. Public health is looking at the built environment, and it's, as you're correct, it's about 3 things. Access, better access for your daily activities. When it comes to the environment, the more you walk and the less you drive, that improves the air quality over time. And another factor that people forget is what is called social equity, better stated social interaction. So when we redevelop these areas, can we create public spaces such as the square in Decatur, small civic areas where people can gather, neighborhood meetings and festivals where surrounding subdivisions and neighborhoods can meet and interact with each other also.
Now, Dr. Ford referenced this earlier. We want the public's input on this plan. So talk to me about how can our citizens get involved with the Master Active Living Plan?
The best way to get involved now is to contact me. But in the next few months, we hope to have these plans underway. We will have a team of consultants working throughout the county. We will have them set up websites so each of the plans can be accessed, and you can always call me for more information also. But in a few months, this should roll out. We're in the early stages right now.
Sydney, thank you so much for joining us on this edition of Let's Talk DeKalb and for all that you're doing to keep DeKalb County healthy.
It's my pleasure. Thanks for having me.
Stay tuned. Right after the break, we'll continue our focus on the health of DeKalb County. And in fact, we'll profile a company in the business of saving lives right here in our county. Stay tuned. You don't want to miss that.
Hey guys, it's Anja the Diva. Welcome home, DeKalb. You say, what is that? Oh, you have a surprise. You're going to get yourself a new home. Yeah. Do you know we have all these houses right here in DeKalb County? Rehab houses that look absolutely beautiful. We're going to tour them. We're going to tell you how you can get some money to also buy your dream home. I told you. Welcome home, DeKalb.
Welcome back to this special edition of Let's Talk DeKalb. Normally, when you're dealing with health-related matters, time is of the essence. In our next spotlight, our own Elena Portier is going to introduce us to a local small business right here in DeKalb County where their cutting-edge technology is helping to save lives across the globe.
Imagine, every year there are approximately 15 million people worldwide that suffer from a stroke. In fact, here in the U.S. alone, more than 800,000 people suffer from a stroke every year. The worst part? 200,000 of those people did not know they were at risk until it was too late.
Almost everyone either has a family member or knows someone who's had a stroke, and it changes their lives.
But Robert Reinhardt and his team at CIS Biotech Incorporated at DeKalb Medical have created a breakthrough destined to change, or better yet, save lives. The team has created a blood test that can predict if someone is at risk of having a stroke within the next 6 months, even if the patient has no symptoms.
When we met with the FDA on that, one of their scientists says this is nearly a perfect test. It's a blood test outside the body, no risk to the patient, preserves quality of life, and saves enormous amounts of money in not having to take care of stroke victims.
Reinhardt is proof of the test's success. He took the test 10 years ago and learned that he was at risk himself. In fact, doctors said if he hadn't taken the test and took proactive steps to combat the risk, he would have suffered a stroke or major heart attack, or both, within less than 6 months.
The test basically saved my life, and there are hundreds of thousands of people out there who, if they had our test and their physician knew they had a problem, they could be prevented from having a stroke.
The blood test kits have been used in the U.S. for more than 12 years and are being used worldwide in more than 27 countries. With each day, more and more clinics and physicians are preventing the heartbreak of suffering a stroke, and CIS Biotech Incorporated is steadily growing from a small business located here in DeKalb County to a global life-saving company.
Thank you so much for that insightful report, Elena.
Stay with us. Up next on Let's Talk DeKalb, how can you tell if your favorite restaurant is making the grade? The ABCs of restaurant inspections is on the ticket next. Stay with us. Welcome back to this special health edition of Let's Talk DeKalb. Have you ever wondered what those posted scores mean in restaurants? Inspecting food establishments here in DeKalb County is the responsibility of the Board of Health's Environmental Health Services. And joining us today to talk about this is health specialist Tracia Manson. Tell us about what goes on during these inspections and what it all means. We are glad that you're here on the show today.
I'm glad to be here.
Now let's talk about exactly what is a food establishment.
Well, a food service establishment is any operation that prepares and sells foods for consumer consumption. These operations include schools, restaurants, cafeterias, catering establishments, adult daycare facilities, and any other retail food service establishment, including those food vendors at carnivals, festivals, and fairs. Now, a food service establishment is not your private home kitchen.
Okay, that's good to know.
Yes.
All right, and so how many roughly of these type of restaurants or food establishments do we have in the county?
At the beginning of 2012, we had roughly over 1,900 establishments permitted here in DeKalb County.
Wow, that's a sizable number. And so how often are these 1,900 establishments inspected?
Well, that depends on their risk type. And the risk type will depend upon their procedures, the foods that they prepare, and their compliance history. If you're a risk type 1 facility, you're a no-cook facility, and you're inspected annually. If you're a risk type 2 facility, you cook, you serve, you hold, you cool, and you're inspected twice a year. Now, if you're a risk type 3 facility, you're under the guise of a HACCP plan. Now, what that means is you want to do something that's prescribed outside of the rules and regulations, such as curing food on site for preservation or offering live molluscan shellfish from a display tank for service. You are inspected 3 times a year, with one inspection being scheduled to verify and validate your HACCP plan.
Okay, and these inspections are really important, and so who conducts these inspections?
Well, the public health officials that conduct inspections in the state of Georgia are classified as environmental health specialists. They're professionals that specialize in food safety and sanitation training and standardization.
Okay, and this is something I think our viewers would really like to know. What are inspectors looking for? What kinds of things are they concerned about?
That's always been the magic questions. What are we looking for? We're concerned about the risk, those hazards that are identified in food service establishments that cause foodborne illness at a higher rate. Those risks being improper holding, improper cooking, improper personal hygiene, and cross-contamination, along with receiving our foods from unapproved sources.
Okay, I mean, yeah, there is so much that goes into fixing stuff to eat to give to the public. So what happens then if, occasionally I imagine there is a violation that is found? What would happen?
Well, it all depends upon the violation that's found. If it's a risk factor violation and public health intervention violation, those are of greater concern than, say, our good retail practice violations. Those violations are weighed more heavily on our form, which is scientifically based and accepted by the Georgia Department of Public Health for use in assessing a food service establishment here in DeKalb. If a risk factor violation is out of compliance, it should be corrected on site immediately or before the inspector leaves the facility. If it's not, then a prescribed amount of time will be given to the operator for compliance. Now, the good retail practices are those that don't cause foodborne illness at a much higher rate, but they're important all the same. We work with the operator to set dates and times for compliance, and then we make a premise visit to come back and check up on the compliance issues there to see if they've been resolved.
It's good teamwork, trying to work with the establishment.
We'd like to partner with industry and not necessarily be known as the regulators. We're also here for consultation.
All right. And so because of the good work that you and your department and fellow inspectors do, I know we don't see this often, but in the rare instance that someone does get sick, what would they look for? What are some of the signs?
Well, you would want to be mindful of the things that you've eaten, where you've gone to eat within the last 72 hours.
Right.
And your signs and symptoms, like you said, persistent diarrhea, vomiting, headache, fever, chills, tingling of the throat, because all of these things could lead to death, which is the ultimate concern of a foodborne illness.
Absolutely, and even in the early stages, it's not fun.
It's no fun.
Not fun. All right, now, just in case somebody is really unfamiliar, the scores I've seen are usually on a yellow paper, usually framed, and they're supposed to be prominently placed.
Yes.
Let's go over some of the details of how can someone look for the score.
Well, the score should be at the facilities, posted in plain public view.
Okay.
If you don't see them in the facilities posted in plain public view, then we ask you to contact the health authorities.
Okay.
But it should be there. If it's your favorite place and you're familiar with it, then you'd want to look for corrected on site. You want to make sure that the violation is corrected on site because the operator cared enough about the safety of his product and his customers to ensure that the violation is handled before the inspector leaves. You
Absolutely.
also want to see whether or not it was a repetitive violation, because if it's repetitive and it continues to go repetitive, then legal action or sickness could result.
So your department has the authority to shut a place down if necessary.
Yes, we do. If a facility scores a score of a 69, which is a U, 2 consecutive routines, or a routine and a follow-up inspection, then we do have the authority to take legal action in that manner. And if an imminent health hazard exists, the facility must close immediately because imminent health hazards pose a great risk to the public safety.
Absolutely. I'm sure that's very rare here in DeKalb County, but it's good to know that we're being kept safe. And I like that the scores go into a lot of detail. You can look at what the actual violation was. Another really exciting thing is, in addition to posting the scores in the restaurants, our residents and visitors have a way to see the scores very easily online, right?
Yes, we do.
Tell us about that.
Our inspection reports are posted online at our website, www.DeKalbHealth.net, and we refer to them frequently. These are public records, so you don't have to fill out any information or paperwork to access this information.
It's very convenient and easy. So, and I know that people will be checking that out as they have more questions about this very interesting topic. And we really appreciate you giving us a little introduction to restaurant inspection scores today.
Well, thank you so much for having me.
You're welcome. Thank you. Now, you want to stay tuned because we've got all the numbers from all of our guests today and websites and all that. We're going to recap it. So get your pen and paper ready. That's up next.
Hello, and welcome back to this special healthy edition of Let's Talk DeKalb. I'm Diamond Lewis.
And I'm Aviva Hoffman.
We certainly hope you've obtained a host of healthy and helpful tips for you and your family on how to remain healthy. Now, if you'd like to find out more information on any of the services and programs we highlighted on this show, here's all the information you'll need to do just that.
If you want to learn more about CIS Biotech and how it's on the cutting edge of risk assessment of stroke and other medical breakthroughs, be sure to check out the website www.cisbiotech.com. You can also reach the company by phone Monday through Friday from 10 a.m. to 6 p.m. at 404-501-3619.
To learn more about the many services and programs and information available through the DeKalb County Board of Health, you can visit online at www.DeKalbHealth.net. There, you'll find information on obesity prevention and West Nile virus and everything else concerning infants, injuries, diseases, and pests, trauma, emergency preparedness, and how to obtain a birth certificate, just to name a few of their services.
You can also call the DeKalb County Board of Health's main number at 404-294-3700. And that same website, DeKalbHealth.net, will lead you to more information on international travel. Go there for vaccination news, a traveler's kit, other travel tips, and links to more helpful sites. You can also call the International Travel Clinics. The number for the T.O. Vinson office is 404-294-3762. The North DeKalb office is 770-454-1144.
For more information on the Master Active Living Plan, you can contact Sydney Dowse directly at 404-371-2178 or send him an email at sdowse@DeKalbCountyGA.gov.
Now, DeKalb County's Board of Health website is also the place to check out restaurant inspection scores. Go to www.DeKalbHealthNet.com and look for the inspection scores under the Food Safety Quick link on the left-hand side of the Environmental Health page, or do a search for inspection scores in the search window at the top right of the home page. To register a complaint regarding health or safety concerns at a DeKalb County restaurant, you can call 404-294-3700. And for more information about many other DeKalb County services and events, you can go to the county's homepage at www.DeKalbCountyGA.gov. There you'll also find on the homepage a quick link to DCTV.
And remember, we'd love to hear your feedback on all of the programming right here on DCTV. Simply shoot us an email at dctv@DeKalbCountyGA.gov or give us a call at 404-371-2989. And of course, you can check us out on YouTube as well. Our channel is DeKalb County GOV. That's DeKalb County Gov. Well, Aviva, that does it for another great show right here on Let's Talk DeKalb. I'm Diamond Lewis.
And I'm Aviva Hoffman, and thanks for watching Let's Talk DeKalb.